Hello and welcome back to Cancer Watch, where we shed light on the critical issues in cancer awareness and prevention. It is a public health program on cancer awareness brought to you by the Cornwood Cancer Foundation and partnered with ARCON, the Association for Radiation and Clinical Oncology of Nigeria, proudly sponsored by Plus TV Africa. I am Dr. Denise Ejo, the CEO of Cornwood Cancer Foundation, and I am honored to have you all join us today for a crucial discussion on how we tackle without ignoring the warnings in urine.
Great stuff. And everybody, I'm Dr. B. today, your co-host, and I'm also the representative of ACON. We're proud to stand alongside the Covert Cancer Foundation and the beautiful work they are doing in association with Plus TV in creating a space where education meets action. Many people don't realize this, but small symptoms can actually point to a serious illness, or it's that bladder cancer. And with us to shed more light on this topic is a renowned urologist and researcher, Professor Udozi Ikeke, who will help us throw light. Together we fight and together we win.
Well, what are we looking at?
Thank you very much for welcoming me. Thank you. It's a great privilege to be with you.
Thank you, sir. What are we looking at? Blood in the urine. Don't ignore these warning signs. So, where are we? Every day, our bodies give us signals, subtle cues that sometimes may be quite right. Or one of the most easily dismissed yet potentially life saving signs is blood in the urine, often brushed off as a temporary infection or ignored due to the embarrassment of fear. This symptom can be a red flag for something far more serious. What is it? Bladder cancer.
Yep, bladder cancer, and it's one of the most common cancers of the urinary tract, and it's especially prevalent in men over the age of 55. It begins in the inner lining of the bladder and can spread if left undetected or untreated. The most common early symptom is a bacteria, which is blood in the urine, hence the topic today. But many people don't seek medical attention and always present in an advanced state, sadly.
So, in this episode, we shine a spotlight on this overlooked warning sign and unpack the risks, the realities, and the life saving power of early detection with expert insight from our distinguished guest, Professor Ngozi Ikeke, who will learn. Wait, let me just make sure. Okay, yeah, we're correct. We'll learn who's most at risk, how bladder cancer is diagnosed and treated, and what can we do to protect ourselves and our loved ones. This isn't just a medical discussion, it's a message of awareness and action. If you or someone you know has ever noticed blood in their urine, even once, this episode is for you. Today, we're helping you to take control of your health through knowledge, early response, and access to expert care. So let's introduce our guest to you.
Indeed, today we have an amazing professor joining us today who is a renowned expert. His name is Professor Oyeledam Ugazi Ekeke. He's a distinguished consultant urologist and professor of surgery at the University of Port Harcourt. He's also the deputy provost of the College of Health Sciences and Chaired the Multidisciplinary Tumor Board in the University of Port Harcourt Teaching Hospital. He's a prolific researcher. He's the author of 5 books and a respected voice in international cancer. For welcome, Professor Ekeke, to the program.
Thank you very much. And I'm privileged and honored to be welcome. Let me start by making people to realize that blood in urine is not synonymous with bladder cancer. So it's not everybody that has blood in urine that should be scared that he or she has bladder cancer. Blood and urine can be due to injury, could be due to infection, but it could also be due to cancer. Blood and urine can be seen. You see color, your urine colored, but it can also not be seen with the naked your eyes. So it can be seen when you do some tests in urine and they discover that there is blood in urine, which we call microscopic hematuria. Hematuria means blood in urine. So there are many causes of blood in urine. Also types, when people see this blood in urine, they go to one place and they are treated, and especially from bladder cancer, blood in urine is painless. So you will not have any pain. We just notice blood in urine. But something typical of the blood in urine that is due to cancer of the bladder is that it comes towards the end of urination. When you start passing urine, you pass urine, there's no blood, then towards the end. We call that terminal hematuria. So we, as the urologists, when we see blood in urine, we do all manner of tests to make sure that it is something we don't leave something that will be treated easily, and that is bladder cancer. Now, we're talking about bladder cancer. We know that cancer, really, from the word crab, is like something, crab with the legs that are eating up the flesh. So cancer is a growth, it's a type of disease that will eat up the individual. Let me use that as a lemma. Now, in the body, there are things called cells. The smallest unit of the body is called the cell. And inside that cell, there is a molecule that is called DNA. Now, this DNA is what controls the normal function and growth and control of the cells. So if there is a damage to the DNA, it can now begin to produce abnormal growths. And those abnormal growths will form a lump, which we will call tumor. And this tumor will begin to spread and invade, depending on where they are. It can begin to touch other tissues. So when you have a lump in the bladder due to abnormal growth, abnormal, uncontrolled, excessive growth of tissue, as you can see inside the diagram that they're showing there. So that lump or that growth that is abnormal and uncontrollable is what we call cancer of the bladder. Now, depending, okay.
Okay, thank you for, that's amazing for you breaking down how cancer develops, the general, giving us a general perspective of cancer generally. And then, of course, I see that what you did there was to now say that when this happens in the bladder, this is really what they would refer to as bladder cancer. So we do know how it develops. But I would like to know, for instance, who is most at risk, sir, of developing bladder cancer? If you could just enlighten us about that.
Okay, so there are, first of all, age is a factor. Bladder cancers, the common bladder cancers, are not seen in the young age group. There are specific ones we see in the young age group. But when we talk about bladder cancers, we have different types of cancers. And on the one we are talking is what we call primary bladder cancer, which is developing from the bladder. There are cancers that will come from other sides and get to the bladder. That's not what we're focusing on. And in childhood, there is a type of cancer that we call rhabdomyolytic sarcoma. It's not the one where it's not very common. It's very in young people. But the bladder cancer we'll talk about generally is the people from 55 years and above. And it's more common in men. And also is more common in people who smoke. And not just smoking, those who have smoked for maybe 10 to 15, 20 years, and then move with a number of sticks a day. So prolonged exposure to smoking is one of the risk factors. Then we have occupation. There are certain occupations where people are exposed to chemicals. So we have people who are working in paint industry. They're exposed to those chemicals. We have, like in River State, where we have hydrocarbon. So people who work in oil and gas industry, in diesel, is you the exhaust from the diesel and construction workers. We have people who are like people do tie and dye, the textile industry. So all those places that you have those chemicals, there are some people who their water is contaminated. Then in Africa, certain parts of North Africa, especially even northern Nigeria, and then some parts of Malawi, and so where you have fresh water and lakes, those areas that they have chronic infection from schistosomiasis, we also have um, such places have a risk. In fact, in Nigeria, over 50 something percent of cases in northern Nigeria are due to those schistosoma related cases. While down here in the south, we tend to see more of the other transitional cell type of cancer of the of the bladder. And we have a few cases that are isolated, sporadic cases, but most of them are environmental. Case.
Well, it's quite interesting because you guys are medical people. I'm not, so I'm listening to you from a layman's perspective, and I'm thinking, hmm, these are the warnings. These are what we need to think about, and we just take life for granted. Okay, so let's look at this then. So, why is blood in the urine a significant warning? What other symptoms can be significant? You know me, I'm very clear because me I have the cancer. I need these answers are potentially very interesting.
Roko. Okay, yes, like I said, when we are uploading urine, we should not ignore it. It is an early warning sign to possibility of having cancer in the bladder. So it should not be ignored, especially these blood and urine are often episodic or intermittent. So it may appear today, it will not appear till the next 2-3 months. And so somebody may go and take one antibiotic and feel that it was an infection and it has been treated. No. When you have blood and urine, it should be investigated. That is one thing we have to say. So one of the ways of bladder cancer can present without you seeing any symptom. If you go for a routine evaluation and you can discover it, but it can also present as blood in urine, which can be seen by urine testing or by the person coming. Then depending on the extent or the stage of the disease, other manifestations can come. The person can be having frequent maturation, passing urine frequently, and having pollen sensation. You may think that it's due to infection. Even if there is infection because there is obstruction, they can have infection, but that is not the primary way of presenting. And it can come with pain. We call it suprapubic area, the place on top of below your belly. So that's region of the body. There may be pain when the person has bladder cancer. Now, if it has spread, it can block where the urine is coming into the bladder from the kidney. The bladder is a sac where urine is drained and contains from the kidneys. The bladder stores the urine, and from there it is expelled. So if those pipes are blocked, it can affect the kidneys, and the person will call with pain in the kidney and may call with evidence that the kidneys are not working. But those ones are seen in advanced cases. Then if you are spread to other organs of the body, maybe the intestine, it can lead to intestinal obstruction. In the lung, it can lead to coughing. coughing out of blood in the bones. The bones may be weak. So depending on the extent, that's how it will present. But the most common thing is blood in urine.
Blood in the urine.
Wow. Okay, we're going to take a quick break now, and after this, we'll come back and complete this conversation. It's gosh, Dr. B, I learn a lot from you guys, because mm, interesting. Thank you very much. Yes, we're going to be taking a few minutes now to take a break, and when we come back, we'll continue the conversation with Prof, who's going to finish up telling us a lot more about the things, the early detection, how we detect, and the occupational hazards and other things that might be of interest and importance to every single one of us. Look forward to see you in a few minutes.
Hello, viewers. Welcome back from the break. And again, we'll be talking to you today about blood in the urine, the warning signs of bladder cancer. That's what we're talking about. And Professor Keke is still with us. Thank you so much, Professor Ish. While you were speaking earlier, you did mention that swimming in fresh water can be hazardous because of infections with schistosomiasis. And I think this is a favorite pastime of many people when they go back home to their villages, go to their streams and their rivers to just swim and all of that. And we did also mention our occupational hazards that are there. So, with all of this in mind, especially for people who go, how can we detect early for bladder cancer? And why is early detection actually very crucial for effective treatment so that people who are at risk will know how to figure out the symptoms?
Okay, so to detect the disease, first of all, if there's a history suggestive of blood in urine, so we'll take a history and find out in that history, we look at from possible causes or exposures, like whether you've been to fresh waters, uh, swimming in fresh water, and then whether you've been smoking, what are your occupational exposures. We'll take all those things into history, and then we'll look for other comorbidities in the person. Then we do physical examination. Most of the time, you may not be able to find anything. However, if we examine the urine, we can do microscopic tests and see blood in urine. That will not make a diagnosis, just shows that there is blood in urine. And then you can also do what we call cytology. Collect the urine, send it to the lab, they can see some cancer cells. And there are some special proteins that can also be seen in the urine that will suggest that there may be bladder cancer. When we go to the hospital, we urologists, we do a test. We use a camera and put into your urinary tract, and we can actually see if there are cancer cells. Now, if we see a lump in the bladder, we can take a bite from the bladder. We do that test called cystoscopy, and then we can take a bite and we'll take it. That will make a diagnosis. Then we will also do ultrasound, CT scan, MRI. These are imaging that will help us not only to say that there is growth, but what is the extent? Because it's the extent that will help us to know what would be the treatment options. So if it is detected early, and that is the emphasis of this discussion, it's curable. That is the main thing. If we have a patient, there are many modalities of treatment, and as oncology and other people talk about multidisciplinary approach to treatment. So, but specifically, if it is early, we can, as you look into the bladder, you can take out the growth. We call this, for the public, we can just say we take out the growth surgically using tiny cameras, so they will not have to cut the person. So we call it transgurgital resection of bladder tube, and then we'll send the sample also. It will help us to now classify these groups Those early ones, we say they are not muscle invasive. And then the ones that are muscle invasive and are going to other stages that are advanced, we divide them into those two basic groups. So these early ones, the treatments are doing that surgical test of taking part of the tumor, and also we may use some chemicals, we call it chemotherapy, we can put inside the bladder. We call it intravesical chemotherapy. We don't need to mention the agents here. Then, if it is not that, if it's muscle invasive but it has not gone so far, we can do treatment by removing the bladder itself and the surrounding tissues, and then creating another way that the person will pass urine. But if it is advanced and every other thing cannot be done, we'll still resolve in reading radiation to treat, using special rays to treat. And we can also do some other palliative measures. So the main thing we are talking about here today, if it is detected early, it is treatable. We have different forms of treatment available. Thank you.
Thank you, Prof. Thank you. So we're going to ask you one last question, and it's very specific as we round off. And it says, what would you say, and this is in one sentence, what would you say to anyone watching right now? What advice would you give to them as we round off?
Okay, please quit smoking. If you see blood in urine, don't treat it casually. Go to the hospital, let them investigate. Perhaps it will be due to bladder cancer. It may not be, but at least let them do the screening. Thank you.
Awesome. So, thank you very much, Dr. AKK, for sharing this critical information. You know, you've put me, I'm thinking, and I'm thinking about, as soon as I start talking, I always find somebody I know that has it in my head that I'm talking to, and I'm like, oh, is this what this person's going through? Thank you for this. Blood in the urine is never something to brush aside, please. I live and I have cancer. I'm begging the public, please don't. Everything that's been said here, it helps us not to go where we don't want to go. And trust me, I know what I'm talking about. Blood in the urine is not just a minor symptom. It's your body trying to tell you something. Please don't ignore it. Get checked and save your life.
Indeed, there is indeed. And we urge everyone that is watching, if you see blood in your urine, then make sure you, because early detection could save your life. So, as we wrap up, join us next time on Cancer Watch, where we continue to educate and empower and save lives as best as we can with our champion, of course, Dr. Denny Angel, ourselves living with cancer and fighting every day that no one should go through this dreadful situation.
Together we fight, together we win. This is Cancer Watch, your guide to cancer awareness, brought to you with compassion, knowledge, and hope. I want to especially thank our guest, Professor AKK, for his honest, very factual, informative, and educational information on cancer, bladder cancer. It has helped, and I hope that it turns somebody's own life around. Early detection saves lives. You can follow us now on our social media handles, and we are giving you our call to action. Share and engage. Join the movement. Help us amplify the message. You can find us on Instagram, Twitter, Facebook, YouTube at Cancer Watch Africa. Tag us on all your posts. Just TV Africa, Congo Cancer Foundation, and Akon. Instagram pages, Just TV Africa, as I said, Facebook page, the Cancer Watch series, Plus TV on Saturdays at 8 o'clock. Don't forget, we'll see you again next week, where we'll be looking at something different, focusing on cancer care and cancer advocacy. in Nigeria. Thank you all for watching us and have a great weekend.